Hi, I'm Dr. Sean Wilen, one of the resident physicians here in the Family Medicine Clinic. I'd like to take the time today to discuss proper hand hygiene. Proper hand hygiene is one of the most simple and effective strategies to preventing infections. In fact, according to the World Health Organization, thousands of people each year die from infections. And oftentimes our hands are transmitting germs like viruses or bacteria. In other words, every day throughout the day when we shake each other's hands or we grab a door handle attached to a door, we are transmitting germs. While there are many scenarios where we should practice proper hand hygiene, the U.S. Centers for Disease Control highlight 3 situations where hand hygiene is critical. Number 1, before preparing or eating food. This helps to prevent the exchange of germs from our hands to the food we eat. Number 2, before touching your eyes, nose, or mouth. This could potentially lead to you getting sick. And finally, number 3, after using the restroom. Sadly, many illnesses are linked with poor hand washing after using the restroom. So, what do we consider to be proper hand hygiene? There are 2 generally accepted ways to properly clean our hands. The first one being a hand rub. This technique uses an alcohol-based formulation to rub our hands together for 20 to 30 seconds. We have these hand sanitizer machines here in the clinic and out in the community to simply rub your hands together. The second technique is to use soap and water for 40 to 60 seconds. Now, the temperature of the water is completely up to you. Pick whatever you feel comfortable with, because the science tells us that hot water is no better at removing germs than cold water. Also, it is quite alright to remind your healthcare provider to wash their hands before performing an exam by just politely reminding them to please rub or wash their hands before placing their hands on you. And finally, for those little children out there, there's a very popular and cute song that we can sing together to make sure that your child's hands are nice and clean. So, please join me in singing this cute little song. Top and bottom, in between, rub them all together, now you're clean, now you're clean. If you and your child sing that song together 2 times, your child's hands should be nice and clean. Now, if you have any questions about hand hygiene, please don't hesitate to ask your healthcare provider. Thank you for coming to the clinic and enjoy your visit.